right, y'all, we're a little behind schedule, so we're going to speed this up. So we're going to have a panel next, and so I'm going to go ahead and invite our panelists and our moderators up to the stage while I'm introducing them, and we're just going to do a little transitions. So our next panel is, the topic is leveraging lived experience to affect change, and I'm really excited to have two of my friends and our advisory board members, Uzuri Holder and Will Baxter, let me say their full names, as our moderators for this panel. And then we are going to welcome Ray Chavez, Demetrius Lynn, Nicole Elliott, and Abdul Hafid bin Abdullah to the stage.
Oh, you all right? Oh, okay, hold on.
Okay, have a seat. Where's? Come on. Oh no, I'm sorry. I had my back to you.
You're fine. I was waiting for them to get in.
Yeah. No, wherever you say. Okay. So while we're getting straight, thank you so much for giving us the opportunity to speak about leveraging lived experience. I'm Uzuri Holder. I'm the program manager for Duke's Violence Recovery Program, which is a hospital-based violence intervention program. We'll hear more about those later, but I'm going to let Will introduce himself, and then we'll get started.
Thank you. My name is Will Baxter. I'm the Community Safety and Violence Prevention Coordinator in Buncombe County, and very passionate about this work, and look forward to you all hearing about lived experience from a wonderful panel. So with that being said, let's have the panel introduce themselves to you. So the first thing we're going to do is briefly introduce yourself, name, organization, title, and if you feel comfortable, can you tell us what brought you to this work?
Peace, community. My name is Ray Chavez. I serve as the Executive Director of Newark Community Street Team. That is in Newark, New Jersey, for some of you that do not know what brought me to this work. Many things. I was a former perpetrator. Today actually marks my 5-year anniversary of being released from a 25-year prison sentence. And while I was about to be released and still in the halfway house, my younger brother was shot in the head, and I had to make a decision whether I wanted to contribute to a blind community or change my life. And so I'm here with you today, so the decision is obvious.
Peace and blessings, everyone. My name is Abdul Hafid bin Abdullah. I go by the name Abdullah. I'm Executive Director of an organization by the name of Quality Life Blueprint, Socorro House, as well as Chasm. And we have a motto, community-based public health response to violence. I'm the designer of that motto. I'm originally from Southern California, kind of grew up inside the 1980s, 1990s, age 17, locked up. And while I was incarcerated, I got the blessed opportunity to understand the science between the mastery of destruction and then the mastery of building. I got a chance to see that in practice. I came home, been doing this work for some time now, and we're here in North Carolina building community health workers and violence prevention and trying to support our communities and work with whomever else is willing to work to make that happen.
Good afternoon, everyone. My name is Demetrius Lynn. I'm from Durham, North Carolina. I work at Duke Hospital, the Violence Recovery Program. What brought me to this work, I'm a pillar of my community. I've been a gunshot victim myself, been paraplegic and using this wheelchair for the last 31 years of my life. So I think I have a lot of expertise to talk about certain situations, setbacks that held me back, and I was able to move forward. So I'm definitely here, proud to be part of this panelist with all these experienced people and talk about the things that helped me get to where I am now and the recovery that we went through. Thank you.
Good afternoon. My name is Nicole Elliott. I am a licensed clinical social worker and a mother. I lost my son in 2019 to gun violence. And so I'm an advocate. I work with survivors. I think that they hold the key in preventing violence because we know firsthand what it feels like. And I'm really happy to be here and to share my knowledge and experience on this panel.
Thank you so much. So earlier today, we heard someone said that, you know, the thing that's missing are people who have experienced violence or are working firsthand with violence. And so we're glad to have you all here today to speak about your experience and kind of enlighten us on what we can do and how we can support. So as a person with lived experience, in your opinion, how do we best serve those impacted by violence and their families? And we're going to have Abdullah start.
So when you're talking about lived experience, let's be clear, every human being has a lived experience. So we're really talking about the alignment of a certain lived experience with a very specific type of population you're trying to support, right? Whatever that issue may be. And when you start speaking about the crisis of violence, you're talking about not just gun violence, you're talking about the crisis of a pathology that gives people permission to hurt other human beings. And when it's prevalent in a certain environment, that's because it becomes normalized, right? And in order to be able to actually denormalize that, it's people who've actually come from those environments, right, who's been able to not only be, as they refer to as perpetrators, I call them participants in it, right? Participants in it, whether you're the one doing it, the one receiving it, or the most important, the one witnessing it, right? So exposure to violence is really key. And if you've been able to go through that particular experience, come out of that experience, now you're activated and willing to learn and educate yourself, specifically inside of upstream strategies to prevent it, right? That knowledge you bring into the equation is a missing component. And that missing component is not just a component that helps you build cohesion and trust in those communities to help them address the violence they're dealing with on a daily basis. 90+% of crimes happens before the police arrive. So who's really preventing violence? The community, right? So if you're a person of lived experience with that community and you want to be able to support that community, your ability to speak their language, your ability to leverage your trust, your ability to leverage how to navigate that environment gives you access. That access can be leveraged to partner with systems who don't traditionally have access, right? So when you're thinking about how to really leverage that, you have to understand that those professionals, not only are they building, we refer to them as community health workers, well-established public health profession, national and state associations support the work that they do. Not only they're leveraging their lived experience within the communities, but guess what? They're also taking the professional language that they develop through a public health lens to be a liaison between systems and communities, to be able to amplify and actually optimize the interventions to not just prevent violence, right, but to intervene, right, while violence is happening, and most importantly, to help human beings recover and rebuild themselves after they've been exposed to that violence. That's the power of lived experience. It has to be leveraged and protected. And the thing you have to protect is the fact that they bring trust. If you force them to break the trust, then they're no different from any other professional.
Just, is there anybody else that wanted to add anything before we move on, or we can move on to the next question? We can? Okay.
All right, so the next question is, how does the intersection of who you are, black, brown, female or male, impact how you deliver or your ability to deliver services to the community you serve? And we're going to ask Demetrius to lead this question.
Y'all will ask me to lead that question, right? I think the biggest thing for me is being a black man, being in my community. Let's be honest, like, majority of the people you see look like me, look like everybody in this room, right? So being a black man is being trusted, who's been through the situations, who's been through the downfalls, being able to reach out and being able to go into the community where you're a pillar, where people trust you, right? People in my community want to hear what I have to say. They listen to me because I'm a black man. I can identify. I think the biggest thing with connectivity is being able to see somebody in yourself. When you can identify the person and see yourself in them, it makes the message that much clearer. Right, once we get to that point, then we start talking about bridging these gaps. How do we bridge the gaps? Being relatable, understandable, listen to individuals, right? Everybody who gets shot or everybody who have individual situations, I mean, you're a bad person. We hear a lot of people talk about the same things, right? We say the same things over and over. It's just how the message is delivered. Sometimes it come off totally different. Me being a victim myself, being able to reach out, people want to know, one, how did I make it? Two, right? I made it. They want to know, what am I doing to continue? Three, they want to know what helped me get there. We're talking about resources now that are here in this community. I was a victim of gun violence 31 years ago. So the struggles now, imagine when I went through 31 years ago at 20 years old. I'm 51 years old now, but I'm living, right? But so a lot of struggles I went through, I had to figure it out. How we're going to get here, it's no resources. We have ample resources now to help in the community, but I think everything is allowed in our community right now, we work so much in silos, right? We have everybody in this room, everybody's in this table. Like, how many have you reached out to other people in this community to realize once you talk to them, we do the same identical thing, right? So we're going back to leverage, bridging gaps in the community. How do we bridge the gaps? A lot of problems that I saw in the past work that I did is because we all competing for certain dollars, right? So once we start competing for certain dollars, we start cutting out other programs because it's about data, it's about numbers. Who are getting the numbers, who are getting the data. But at the end of the day, we have to remember why we're doing this work. We're doing this work to build our communities, to help the individuals in the community who are down, who are out. In the hospital where I work at, when we see people, they are their lowest. Individuals come into the hospital who are victims of gun violence. They're their lowest. They're vulnerable, right? So it's about trust, building relationship, about transparency. I'm very transparent with everybody I work with. My whole life is transparent. I don't mind sharing my story with anybody because I know what I went through can help the next person that's going through something. We're steady trying to learn. I don't know all the answers. We don't know all the answers. That's why we're here together. That's why we're working together. We're trying to bridge these gaps and continue to try to build our community. I think those things, those aspects, the things that I went through, the things I'm doing now, it kind of helps me go into my community to be able to speak and let people understand that I have a voice and they want to listen because, being honestly, a lot of people look at me and say, wow, what happened to him? I want to know. I'm curious. That's when I had the opportunity to take my time to share what I went through and try to help a lot of people in my situation. So I think that's what helped me go into my community and make things a lot better.
Yeah. I was going to answer that one. Because who I am is a black woman. So, and a black woman who has lost her son to gun violence. So my perception of this whole thing is different. I have to always stay grounded in my purpose and understand that while these emotions may come, the picture is bigger. I can't do anything to get Marcus back, but I can help another mother. So the way that I navigate through this thing, having my own nonprofit and advocating for other moms who can't advocate for themselves, who need food and housing, who can't pay their bills because they're distraught. They lost their husband or they lost their son or they lost their grandson. So how do I advocate for these women with my own pain? So I really have to stay grounded in my purpose and know who I am. I'm not just a woman. I'm an advocate. I'm an activist. And I have to separate that grief and that pain, deal with it, but be sure that I show up for my people because I'm their voice.
I think for all of us, we can speak to really understanding our role in the work that we do, right? Me as a woman, her as a woman, you guys as men, and how we show up. All of us have varied experiences, but how do we use that experience to support those around us and even those that we work with, right? Because this is heavy work. It's not easy. One of the things that, I felt was important when I started doing this work in the hospital was to listen. So my staff, I listen to them, right? I don't know Durham. I'm from New York, right? But they have to tell me about Durham. They have to tell me their experience. And so that guides my step. And so I think this question is really good. So moving on to the next question. What do you think people need to know or understand about the importance of including the voices and perspectives of those who lived experience in efforts to address community violence? And can we have Ray lead with that. Thank you.
Thank you for that question. The things that individuals need to know. We need to know grace. I think that that's first. We need to know grace. Individuals have to understand that they are the sum total of their lives, and coming from a former perpetrator, we don't always know how we got there. It's a combination of things, ways that we were bred, ways that we were taught to respond to things or respond to our anger, respond to our ego and things like this. So that grace is something that we need to understand when we're dealing with community-based public safety professionals and staff that have lived experience. Secondly, because that pendulum swing both ways, community-based public safety professionals also need to understand that they live in a society with multi-dimensions. And so in this professional world, just as you ask for grace and you ask for understanding, you should also seek understanding. So that way you understand that the world is not revolve around you, but we're all in this world together. So I think that that is very important that we understand. And then we move on to the unhealed traumas that individuals deal with even when they move into their professional spaces. Individuals need to understand that that is a real thing. If I've been away for 20, 30, 40 years and I decided that I wanted to go and get my degree and take a job and set out on a different path, that took me all but 4 to 5 years. But for 30 years, my response to anger has been such. My response to ego, pride has been such. And all of these shortcomings will show up in that time of despair, in that time of panic. So I think that we all need to understand that. And I think that when we all are enlightened by each other, our whole reality, the sum total of our lives, the culture shift, the social responsibility that comes with taking on a life of professionalism versus living according to the underworld, I think that we can all come to a place of understanding and move forward better together. So that's what I would say. I would say grace and enlightenment is what we all need to understand when we're working with individuals with lived experiences, and with individuals with lived experiences are working with individuals that have been on a professional track, for lack of better terms, most of their lives.
Did anyone else want to add anything to that before we move on to the next question?
I think you did an excellent job answering that question. I think the biggest thing is that, so the world of public health, the world of public safety, the world of mental health, the world of education, the systems where they got the support of academia, they got the support of professional development, are very well equipped, right, to address many of the challenges in our society. And unofficially, communities and unofficial community professionals have been also doing it as well, too. We've been surviving for a very long time, They're surviving a whole lot of things in our society. It's just been considered unofficial. Now there's this merger of two worlds, right? What has been identified as being valuable because they've been able to just change their communities, because their communities are actually not allowing themselves to be deteriorated because of the actual structural breakdown, right? Lack of resources, poverty, et cetera, et cetera. We're starting to see that there's people from those environments that can help us do this work. I think the brother Ray did an excellent job of expressing the trauma that needs to be understood within themselves as well as when they go into the workplace. What I want to talk about is the professionals that's going to tap into this profession, right? How we manage them, how we handle them, right? How we choose to govern them, right? You're talking about a population of individuals that give you access to places that you don't traditionally have access to. What you allow them to do or what you send them to do can either continue to give you access or it can deny them and you access, right? It can also harm that very population of people who's already, right, coming from being a vulnerable place and actually overcoming the struggle of crisis. So for the people that's interacting with this profession, what I would ask for you to do, right, is give yourself a little bit more time to understand, right, and be appreciative of what they're bringing into the actual space so that you can truly understand how to optimize this, right? And we don't miss this opportunity. Because what you have in some cities, depending on how those professionals are leveraged or not leveraged, a whole generation can be cut off. A whole generation can be cut off. You got young men coming from the streets, coming from prison, young sisters coming from certain environments of substance use disorder, et cetera, et cetera. They're ready to do the work. They're excited, they're motivated, the community's excited, they're happy to see them doing the work, they're out there, they're moving, and everybody's excited, and all of a sudden, their reputation is completely slain because of some moves that's been made that wasn't considerate of their vulnerable situation. So that's my only thing I would add is that let's value this profession, protect this profession, and build on this profession. It's a huge opportunity.
All right, so our next question is, what challenges or barriers have you faced in your transition from experiencing violence to working towards preventing or stopping it? And we're going to ask Nicole to answer this question for us.
Okay. So I had to, my transition from experiencing the violent act that happened to my son in 2019 to now, wow, it's a journey. And I recognize it's a journey that I'm going to always be on. It's not just a transition from one thing to the other and it's gone. No, because Marcus never came home. So I'm always feeling that. So I have to be mindful at all times of where I am in my own healing. And I like where we were going. We were talking about leveraging and working with people who have experienced violence. You have to make sure you're giving them space and time to feel their feelings. I was told at one point, I should just get over it, just get over it. I'm like, what? Of course, it came from an older lady at my church. She felt like I should get over it. And here we are 5 years later, and I'm not over it. But this energy that I have, I can use it, knowing that I'm always in this transition, I'm always in this phase of constant transition. I know that I can use that energy and I can pour it into other mothers and other sisters or aunties that are missing their person. So see, in 2019, I had no idea that all of this was going to happen. I had no idea that I'd be sitting here or that, that violence would be a national health crisis. I had no idea that this thing was going to happen. I thought it just happened to me and I wanted to help a few people. But now look where we are. This is a great opportunity for us to save lives. And it's really exciting. So when we talk about the challenge with the transition, I think it's an ongoing thing. Your experiences is what make you who you are. It makes you who you are. So it's really not a transition. It's your life. And you do things, you use your experiences, you use the things that happen to you to try to pour into other people and help them along the way. And so, yeah, I don't know if it's a challenge or if it's just what we do. I think it's just what we do.
And anybody else want to expound on challenges? Pass.
Speaking from my end, I can speak about a lot of challenges, right? The transition. I'm very transparent about the work I do. I have a passion for this work. All right, so imagine being a 20-year-old who was in college playing football and come home from the summer and catch a bullet in the neck. Now you can't walk. Imagine applying for disability and you're told you haven't put nothing in the system. You can't get nothing out of the system. Imagine the frustration level that sets in for this young man. Imagine 2 years later, you get shot again from already being paralyzed. Imagine now you gain custody of your oldest kids and you try to go to assistance. And remember, you can't get assistance because you caught a drug charge from being frustrated. You start selling drugs and you got arrested. All this is compound. At 25 years old, where do you go? I have a passion for this work that I do, right? This is not tears of sadness. These are just tears of joy because I know my struggles. I know what I overcame. I know what I went through. So I know where I am now. My work is not about me. I'm only doing the Lord's will. It's not about me. This is about me trying to help save another soul. That's what I have to do as an individual. We all on borrowed time, right? So my work is not about a legacy. It is, but it's not. I don't care about what you say about me now. What I care about is when I'm gone, what you got to say about me then. So my kids can hear it. The impact that we put in. We all have a duty. We all have a charge. We all have a duty. If you're not investing in this work, find you something else to do. Find you something else to do. Let's stop taking money from these agencies. Let's stop taking this government money and short-stepping. We're changing people's lives. People are dying at our hands, right? It takes a second to take time to just listen and pour into somebody else. I was able to get myself together, went back to college, graduated from college, sent my kids to college. I did so much work in my community. I was so good for what I went through. My DA in Durham County took me back to court and dismissed all 5 felonies that I ever had. So now here I'm this man, a clean slate. I have no criminal history. This allowed me to get a job to work into Duke Hospital to start employing and impacting the other people's lives. I think what we do now, I can bridge the gap when we have the people we talk to as far as the individuals we work with. In the hospital, I'm able to bridge the gap. We are able to bridge the gap. Not only me, my coworkers and everybody I work with. So nobody in this room, wheelchair, electric wheelchair, gurney, none of you guys gonna outwork me. Nobody. Nobody in here, I promise you that. I'm gonna do whatever I gotta do to help save a soul. If I can't help that young man, I'm gonna reach out, I'm gonna help his family because it trickles down to the kids too. So that's all I have to say about that. Thank you.
So we did have another question to ask y'all, but I think maybe we should move to, if anybody has any questions for anybody on the panel here, we have a few minutes.
I got a question for Ray. I saw you speaking a few months back, and when y'all talked about the street outreach program y'all have and the relationship y'all have with the police department there in Newark, I really like the way that was being handled. Can you give us a little insight on how y'all's relationship is with the police department? If I need to explain what I was seeing, I can do that as well.
No. Peace, brother. No problem. So the relationship that we have with law enforcement up in Newark was facilitated by 2 things. We have one out of Equal Justice USA called Trauma to Trust. It is an opportunity for community members and law enforcement to come together and kind of like air out things, clear some misconceptions, clear some miscommunication, set boundaries and standards, give the why. And what that did was establish relationships. Like I said earlier when I spoke, it's about enlightenment. A lot of times law enforcement individuals or individuals that would be law enforcement stayed on that side of the streets. And the individuals that were non-law enforcement stayed on their side of the street. So we really never got a chance to know each other, even if we lived on the same block and we lived in the same school. So Trauma to Trust kind of facilitated that. Secondly, we have a one-sided relationship when it comes to sharing information, which is very important. And I think, and I would say it publicly, I would say it privately, I would say it anywhere, because in order for us to be effective in our community, we understand how important it is for us to maintain our credibility, because overall, our allegiance is to the community. Our allegiance is to our community. It's to serve the vulnerable population. The vulnerable population is not necessarily sitting in City Hall. The vulnerable population are not necessarily sitting in any institutions. They're sitting in the community. They're being released from incarceration. They're being released from treatment centers, so on and so forth. And in order for those individuals to accept our services and be receptive of us, they have to validate our relationship. They have to say, I trust you. I trust that this will not end up in a punitive response. I trust that you will not run my name for a warrant by just serving me. I trust that if I say that I want to turn myself in through safe surrender, or I want to turn the weapon in, or I want to talk to you about how I just put my hands on somebody, that it won't end in a punitive response, but you will ultimately employ your conflict resolution skills to help me come to a community-based peaceful resolve. That is very important. And so we have to explain this over and over again. I think that our law enforcement community are more and more understanding, the more and more we echo this in our community, that we won't change that way. That's uncompromisable because of who our allegiance is to. And I think they understand it at this point because, being honest, they can't have conversations with people we can have conversations with. So it makes no sense for me to get you in that business because they'll never talk to you anyway.
One of the things that I heard one of the officers say is that when they hear about stuff, they come to y'all so that y'all can dispatch to where there may be some tensions growing, and y'all can help kind of quell that before it jumps off.
Absolutely. Every other week, we have a bi-weekly public safety roundtable where we convene a host of community members, stakeholders, law enforcement. They give their CompStat report. We highlight other community partners. And at that case, law enforcement has the opportunity, our captain or our lieutenant has the opportunity to let us know where it's hot at, what areas it's hot at. And immediately, I have high-risk interventionists on the call, and they're jotting down notes. When that call is over, they're canvassing that area. They're going to talk to the brothers and sisters, the block lieutenants in that area, and this looks like we're having a conversation around social responsibility. This does not mean we coming to tell you that you can't do this, you can't do that. That's just not realistic. That creates an us against them approach. You have to approach them with a trauma-informed lens, with cultural competency, and you have to talk to them about social responsibility. That's ultimately what it boils down to. I learned something recently, and I've been carrying it with me in my arsenal ever since. People don't resist change. People resist being changed. So if you incentivize change and you empower people that have been deemed powerless around changing and how that would better their community, increase the value of their mom's house up the street that they grew up in, that they didn't realize the shooting down the street affected that cost value, so on and so forth. When you incentivize these things and you empower them with information, then they buy in. And because they buy in, we're able to reduce violence in the community, and we're able to reduce violence around this country. I hope that answers your question, brother.
CR, can I beg you for a few more minutes because we were, okay. Thank you.
Yes, thank you for that. And I'm familiar with the work that's happening in Newark. I've been speaking with your folks there, Brother Akil Bashir, as well as my brother's Keepers, the organization that's doing that. So I'm curious if, well, not curious, so I have an understanding of what it took for you guys to get to the place to create infrastructure to do the things that you're doing. Like you talked about the roundtables, and I heard how effective that was. But I know that was heavy lifting work due to political, just due to the politics as well as the relationships. But can you just share more about that, like what it really takes in terms of building out that ecosystem?
Certainly, sis. Every day, we have not arrived yet. You said what it took. We have to fight every day. 10 toes down, in the community, being received by the community, beating that pavement, showing up every day. We have not arrived yet. And regardless to what you may have heard, every day, every week, we have to fight for validation in that community. We have to get the approval of the community. We have to get the approval of the taxpayers, because if the community don't respect you, then you're not valid. Community starts with the community of the people that were voiceless. That's where the community starts. The community starts with the people that we call perpetrators, the block lieutenants, the elders on the block. That represents the community. And then it goes upwards towards legislators, the local business owners, so on and so forth, where we check in with them on our community walks. We share with them what's going on. We invite them to the community walks. We invite them to the public safety roundtable. We invite them to share their questions, comments, and concerns, and then we come to a peaceful resolution, or we come to a resolve. And if policy has to be implemented, then we implement policy. And once that momentum gets going and we realize that we're all in the fight together, social facilitation is amazing, family. Social facilitation is amazing. When you look to your left and your right, and you see a brother working on this side doing housing, and a brother working on this side doing mentorship, and a brother working on this side doing violence intervention, brother working on this side in the hospital, a brother over here helping with victim services, trauma recovery clinicians over here, all willing to roll up their sleeves to come together. That's what the community looks like. And so we have to continuously doing that. And when we bump our heads, we got to go back to the drawing board and figure out something else that works and come back out and present that. And if that works, we keep moving with that. And then we build as we go, because we don't know what we don't know. This is an industry that we're building. We're not building a business. And because it's an industry, it's constantly evolving, and we need to evolve with it. And if you lack stamina, if you lack endurance, and if you lack patience, if you're one of these people that says, I'm tired of repeating the same thing over and over again, you're in the wrong business. You're in the wrong business. Because in order to shift a paradigm, which is what we're doing, in order to shift a paradigm, you need to be intentionally repetitious, intentionally repetitious, and pushing the narrative of peace. That's what I have to say about this.
We have time for one more question. I got a signal.
Can I add to something real quick?
Go
I
ahead.
think the brother Ray also mentioned, we said community, right? So any community is clearly defined by demographics and geographics, because things change from environment to environment. But also, I think he mentioned the language of like street lieutenants, right? So let's just be clear, right? Yeah, there's certain individuals that hold certain communities hostage because they choose to have a certain behavior, but they're not the actual say-so or the people who are dominating the community. They don't control our communities, right? So when you think about a community, if you're providing resources in your community to those grandmamas and to those aunties and to those uncles or whatnot, when their loved ones is done being an idiot on the block and inside prison, right? If you're that same individual that's making sure their children get to school safe, you're the same individual make sure that grandma gets what she needs when it comes to actual food, when it comes to other resources, Medicaid, et cetera, right? You're building a relationship, a cohesion in the community to where you'll begin to see that other people begin to say, let them do what they do, right? And your voice then becomes that, in addition to engaging the street lieutenants, right? So there's this, just to answer your question a little bit more, I think my brother was ready for it. He boots on the ground out there dealing with the cats out there with the pistols in their hands. I know where he's at. But for everyone else, understand there's this also within that, there's also a broader, more, I want to say, expansive type of way to build cohesion and relations inside your community that can also shift norms and give you the capacity, because eventually over time, when there's crisis, some of those young men is going to come to you, right? Or when they're looking for some help, the pastor is going to tell you, go talk to them, right? Letters of recommendations. I don't want to hold you, I know we're over time, but I just want to give that extra piece of, yes, like that's community, but there's also the traditional community that we want to tap into.
So we have time for one more. One more. Uno más.
Thank
We got
you.
someone here that she never asked
They
a
gave me
question
the
yet.
microphone.
Oh, okay. Okay.
I get to go. Anyway, I want to stand up and appreciate you all on stage. Thank you. Thank you for what you're doing. And then I want to look at leveraging lived experiences. Always around you, let's get sober. There are people with a lived experience. You can't look at me and tell that I've been shot 7 times. You can't look at me and see that one of those bullets went through this side out the other. The other one at the back of my neck, one at my chest, one down here, 7 bullets. But the other lived experience is my child was 7 years old. His lived experience is he was taken from his school, moved from Mecklenburg back to Buncombe County. The lived experience of the principal was that he got a parent coming in one day saying, my son is going to be in your classroom. I don't know if the man that shot me will show up and try to take him from the school. There are lived experiences in your community that people are going through from a stage of violence. Let's get sober. There's a reason that we need this whole department, this public safety. There's a lot of reasons we need it. In your midst are people standing on a stage of historical trauma. As a people, we all have gone through historical trauma. So let's get sober. We got work to do. I thank you all for doing it. When I got shot, all I could do, I got off my bed and I thought, I got to go to work. I didn't even know about community programs. I just knew I had a child and I need to support him, and I had to start over back in my home base, which was good. I got to go home where there was a support base for me. And there are people in your community. I had a cousin recovering from drugs. I had a nephew recovering from just mental health, mental illness of losing his father too soon. Let's get sober. There's a lot of lived experiences. And what you have is the capacity to make a difference.
Thank you. All right, I think, oh, you giving one more? Okay, here we go.
Good afternoon. Thank you to the panel for all that you're pouring into us today and for all that you're pouring into your respective communities. I lost my son in 2019 to gun violence, just like Ms. Nicole Elliott. So my question really is for Ms. Elliott and the others there as well. The survivors rarely have a space in places like this to elevate the voices of what we've gone through and the things that we're doing in our communities. How best have you been able to leverage partnerships with other CVI-focused organizations to help your communities be better?
So I live in a very rural community. So I haven't been able to create those relationships. I took time. Marcus left me in 2019, and I created the project in 2019, but I took time because I couldn't help people until I was my best self. And when my baby was murdered, I was not my best self. I needed time to heal, and that's what I encourage others to do. Because if you're playing around and you're only half full, you can't pour that into anybody else, because then you'll be empty and you're not doing any good to anybody. What I do in my community, though, is I help the families, the mothers. I pay a lot of attention to moms, understand that this isn't a natural occurrence. Losing your child to violence isn't a natural occurrence, and we shouldn't normalize it and pretend like it's okay. I encourage them to feel the anger and to put that somewhere that can be of good use, because the pain doesn't go away. I'm sure you know. But the thing that we have to remember is we have the ability to impact so much change because we feel it. We are living it every day. It doesn't go away. So while I'm not partnering right now with any state organization, I say right now, with any state organizations, my nonprofit is growing. And one of the things I do too is I encourage moms to always celebrate their children. You know, their birthday is still their birthday. Their transition date is just as important as the date they came into the world. So you have to celebrate your child. Celebrate your people.
And I know you're getting ready to wrap up. I just want to answer the question for you. I think, so the population of people that we train, so we train community health workers in violence prevention. They're no different from any other professional that's out here. But contained in those professionals is such a rich ingredients of experience, including being survivors, being victims, being people who've perpetrated, right? People that's been exposed to it. So when you have those professionals, from those professionals become links to other community-based organizations, other community-based networks, right? And in that, when you begin to build and focus building cohesion and trying to optimize that cohesion, you're optimizing community assets, right? And it's those community assets I want to encourage everybody as we wrap. We want to begin to think about that. like one of the actual mandates, I think, for Sierra and the actual Office of Violence Prevention in North Carolina is building power, building capacity within communities. There's such rich ingredients, right? And it's like almost like the brain synapses, ways in which the actual community operates, right? If you can help to activate and strengthen that, all those needs that we're talking about, whether it be survivors, et cetera, not just gun violence, child molestation, rape, right? You know what I'm saying? So many different other forms of harm begins to operate and begins to re-heal and restore itself, and it begins, like the brother Ray said, it begins to stand up, right? Ready to actually transform its environment. So I just want to say that, like, it's the people that you're training and you're engaging that actually has those components. That's where your network really originates from.
I just want to say one more thing. Sometimes one of the barriers too, some communities don't even realize that they have a problem with violence. And so part of my work in the communities that I serve is helping them understand that you have a problem with violence. You have a violence problem. It's not just gun violence. Like you said, violence has so many faces. And so educating people and letting them know that this is actually an issue is very important.
So this group is going to be around. Tap in with them. I can guarantee you that we'll make themselves available to speak. Just a huge round of applause for this panel.